Hey, have you ever had that feeling you're right in the middle of a crazy clinic day? A learner says something that's not quite right, and you think, this is it, a perfect teaching moment. But then, before you can even figure out what to say, the moment's just gone.
Well, what if you had a tool, a mental framework, to grab those moments every single time? That is exactly what we're going to break down right now. We're talking about how to master the teaching script and turn those fleeting opportunities into some seriously powerful, high-yield learning.
I mean, we all know this scene, right? The waiting room is packed, your inbox is exploding, and you've got maybe, if you're lucky, 10 minutes between patients. It feels like the absolute last place you'd have time for any kind of real, structured teaching.
And that's exactly why these little moments are so incredibly easy to miss. A learner presents a case, you spot a clear gap in their knowledge, but the pressure is on to just keep moving. And just like that, the window closes. A chance to help shape a better clinician is lost in the shuffle.
Okay, so let's get into the solution. And here's the key. It is not about finding more time in your day. It's about using the tiny pockets of time you already have, way more effectively. The tool we're talking about is called the teaching script, and it's built for exactly these kinds of high-pressure, time-crunched environments. So what is this thing really? Well, think of a teaching script as a simple 5-step mental model that you can run through in your head in just a few seconds. It's basically a framework for taking a quick, informal chat and giving it just enough structure to become a focused, memorable, high-impact learning experience.
And the framework itself is just brilliantly simple. Let's walk through it. First, you identify the trigger. That specific thing the learner said or did that caught your attention. Second, you lock in on the single, most high-yield teaching point. And I mean just one. Third, you quickly think, what's my evidence for this? Fourth, you pick a teaching strategy. Is it a question, a quick diagram? And fifth, this is the golden rule. Keep it brief. We're talking 3 to 5 minutes max. That's the whole thing. It's simple, it's structured, and it is so effective.
All right, so that's the theory. Let's see how this thing actually plays out in the real world. We're going to start in a busy outpatient clinic. So here's the setup. You're the preceptor, and a junior resident just saw a 68-year-old patient whose blood pressure is still way too high, even though they're on medication. And there it is. The learner says, I guess we'll just add another medication. Ding, ding, ding. That's our trigger. They've made an immediate leap to a purely pharmacological solution, completely bypassing the bigger picture.
So, in a split second, the preceptor's mind runs the script. Okay, trigger. The learner totally ignored the social determinants of health. The high-yield teaching point, let's connect the dots between something like food insecurity and medication adherence. The evidence? We know clinical guidelines stress the importance of SDOH. And my strategy? I'll introduce them to the LANES model. That stands for Link, Assess, Normalize, Educate, and Share, which gives them a concrete tool for this kind of conversation. And the best part? I can do all of this in 3 minutes flat.
Now, what's so cool about this is how the same exact tool works just as well in a totally different setting. So let's leave the clinic and head over to the inpatient wards and see it in action there. Okay, now we're on rounds. An intern is presenting a new admission who's got swelling in both legs. A classic, everyday clinical problem. The learner offers up a differential diagnosis. Maybe it's the heart, maybe it's the kidneys. And once again, that's our trigger. It's not that they're wrong, but the differential is, well, it's a bit thin, isn't it? It lacks structure, and it definitely lacks breadth.
So, the attending runs their script. Trigger. Weak differential. High-yield teaching point. You need a schema. It's the absolute key to structured clinical reasoning. The evidence for this is basically the foundation of medical education. So my strategy? A quick trip to the whiteboard. Let's map out a schema for edema. Cardiac, liver, renal, vascular, and lymphatic. See? This turns an abstract idea into a memorable, visual tool they can use forever, all in less than 4 minutes.
So you see, right? In 2 very different scenarios, the teaching script gave the educator a clear, fast, and incredibly effective path to high-impact teaching. It's all about seizing that moment. And looking at them side by side really shows you the flexibility of this tool. In the clinic, the trigger was a gap in the management plan. So we used a communication tool, LANES, to give the learner a broader perspective. In the hospital, the trigger was a gap in diagnosis, so we used a cognitive tool, a clinical schema, to help them build structured reasoning. The context changes completely, but that 5-step script, it stays exactly the same.
So here's the most important takeaway. The teaching script isn't just one more thing you have to do. It's a mental model that takes a moment of learner uncertainty and, let's be honest,
often a moment of preceptor chaos, and it transforms it into a shared moment of real, focused clarity.
It really arms you to be a more deliberate, a more intentional, and a more effective teacher, even when you feel like you have absolutely no time to spare. So, the only question left to ask is, what instructional moment are you going to seize tomorrow?